Okay, quick question. Have you ever caught yourself thinking, why does my sleep feel different than it used to? Or why do I recover more slowly? Or how about, why does stress hit me harder than it used to?
Or like you're doing the same stuff you used to and your body says, cute, try again.
If that's you, first of all, you're not alone. Today, we're talking about hormone in the context of bone health.
And we're keeping it simple. This is not medical advice. This is what's happening in real life, what we're doing, and how to bring clarity to your care team. So, Jayson, why is this in a bone health series? People don't always connect those dots.
Well, our bodies are more than just bones. They're the hormones, they're micronutrients, they're the protein that we eat, because hormones shape the environment your bones and muscles adapt to. Sleep, energy, mood, recovery, and yes, bone remodeling.
And the tricky part is hormones don't usually change overnight.
It's gradual. You don't always feel hormones, but you do feel the effects. You're more fatigued, choppier sleep, your recovery takes longer, and your progress feels slower.
Yep. And people start blaming themselves.
And they shouldn't.
So this is the part I see all the time. Women are like, what's wrong with me? I don't feel right. Something is just off.
Yeah, and that's what I want to remove today, that shame. Because when women get hormone clarity, the self-blame disappears.
Yes. It's not you're failing. It's your body is in a new season. And that's a really important differentiation.
Yeah, exactly. As we age, our physiology changes. It's not something we are doing wrong.
Okay. So quick myth versus truth.
If you just work harder, everything goes back to where it was when you were 35. How about that?
Well, that's a myth.
After 45, the best strategy is work smarter with better input, better tracking.
Truth. Because the system isn't broken, it's updated.
Exactly, a new operating system.
Right. So what hormones are we talking about without turning this into a science project?
At high level, it's estrogen and testosterone. They shift in midlife and can influence everything like sleep quality, joint comfort, how your body uses protein, and how quickly your bones turn over.
Yes, which is why some women and men feel like they're doing the workouts, they're eating well and doing everything right, but their body just isn't responding the same. I know I've experienced that, and the two of us have talked about it together.
Yeah, aging well is a full-time job. That's where each pillar comes in. Stimulus gives you the signal to grow soft collagen. Protein supplies the building blocks. And then it's recovery. You have to be able to recover for it all to work. Micronutrients support the process through enzyme function. And then hormone context explains the environment.
And context really is the perfect word. We're not treating anything. We're understanding the landscape. Okay, so here's where we get practical. How does imaging fit in?
Well, that's a great question. This is where everything gets calmer. When you walk into your clinician's office with a baseline scan and a simple 2-week log, and then you're not guessing. You're bringing in your patterns so the doctor can understand what's happening.
And that changes the tone of the appointment.
Totally. It turns off, I feel this way, or this has been happening to me. You know, we have data to actually present to your clinician team.
Yes, and that's called teamwork. It helps you advocate for yourself without sounding dramatic or sounding overwhelmed. So let's give them the log and make it super doable.
2 weeks, nothing fancy. Just quick notes daily. We want your sleep quality. How good is it? Was it okay? Did you get enough? What's my energy level right now? 1, 2, 5. And mood. Is it steady? Do I have hot flashes? Am I quick to anger? And then what does your stress level look like? You know, again, these are 1 to 5. It's a quick assessment every day. Protein with meals, yes or no. This is where you can use an app like Chronometer to track your caloric intake.
And we're really not trying to be perfect here. We're just trying to understand where things are changing in our body and look for patterns, because patterns help. And it helps you to see what's actually moving the needle. This is basically our whole approach, right?
Right. So first it's test. We learn what's going on within our body. We make actionable choices, and then we retest. So test. That baseline scan, that's your REMS. Then you're going to learn what's going on. What is your body telling you? Then you're going to track. And you're going to rescan and watch the trend over time.
And trend over time beats panic over a singular number. So let's remember that, because everything is changeable.
Always. What we find is 1 point in a DEXA or a REMS can really affect your mental health because you're so focused on that one number.
Yes. All right, so let's put together an action plan for the next 2 weeks. Go.
All right, start the 2 week log. You're going to keep working on your pillars. That's the stimulus, the nutrition, your recovery, and your micronutrients. And if you haven't yet, book a baseline scan so you can have real data.
Because your clinician can't help you without clarity you don't have. And if you're guessing, you don't have the answers.
Yeah.
Clarity first and strength follows.
See you next time.
Bye.